Hey,
Well,
Mr. Mayor.
welcome again to the Cutting Edge Show. I'm Omar Neal. I'm one of the hosts of this wonderful show. You can catch us each Thursday at 6 o'clock Central, 7 o'clock Eastern, as we talk all things health and wellness. And again, this is a great show. It's a show that we engage people from all walks of life in talking about issues that are important to them and to you. You can catch us on all of our social media platforms, the Facebook, YouTube, Instagram, and Twitter. And of course, you can always make sure that you can check out our newsletter by using the QR code, and just put your camera there with your camera, and we'll take you right to our newsletter. We put that out each and every week with a lot of helpful information for you. Well, I said that I'm one of the hosts. Well, the other host is none other than Dr. Stephen B. Thomas. So we call him Dr. T in these parts. And of course, he is professor of the University of Maryland School of Public Health and director of the Maryland Center for Health Equity. Ladies and gentlemen, my co-host, Dr. Stephen B. Thomas. Dr. T, what's going on, man? How you doing?
Hey, Mr. Mayor. You know what? It's been a very, very interesting day. But first, let me just comment on the new photo profile you got in the slide deck. I really like that one. The sun is shining on you. In many ways, it's a reflection of how we are all feeling. The sun is starting to shine. Are we getting out of the danger? I mean, a lot of what we need to talk about has to do with how we move forward together.
Yeah.
And there's some good things and some silver lining, but still some clouds.
Right.
Still some clouds on the horizon.
Well, the thing too, and I think it's us to be watchmen on the wall. I see that as we look into the horizon and to alert people when danger lurks. And so that's our work, and not to alarm people, but to inform people as to what the realities are. And so we are, yeah, and that's what we do here, man. I'm excited about the show today, Dr. T. Because we entitled the show that is not over till COVID says over, and COVID's not talking.
There we go.
And the reason why this show is so important is because there are a lot of people, and I think that Hawaii was the last state to lift mandatory public health mitigation measures.
That's right.
Right. And so now people are out there, and there are many people who are unvaccinated.
Yes.
Who are walking around as if they are protected, and they aren't.
Caution to the wind.
Yeah, absolutely, man. And they're kind of playing Russian roulette with their lives. And I know that that's a recipe for a disaster. I'm going into stores now, and even the workers in stores are not masking. And so we got people who are coming in, no masks, people working there, no masks. So, it's like looking at a train wreck. I don't know where we are standing with this. Yeah.
Mayor, it doesn't have to be. And so one of the things that we've done on this show is begin to have people talk more about respiratory protection and not just a face covering. Ask themselves, who are you sharing air with?
Right.
And therein lies some things that we can do to help people get through this next phase. We don't want this to be a fumble. I don't think it's a fumble yet.
Right.
But it could be.
What's interesting? You have, we talk about how you frame the issue determines who embrace the cause, right?
Yes.
You have really, capsulated that notion of who are you sharing air with? And I think about that, and I think about you everywhere I go. Do I know who I'm sharing air with? right? And if I don't know, even if you know,
There you
how are
go.
you protecting yourself? Are you
Mm,
out in the open where there's less likely of transmission,
there you
or
go.
are you in a closed space? How ventilated is it?
That's right.
All of those things are things you need to consider. Is what I'm saying.
And here in the cutting edge, we help people with that COVID calculus.
Yeah.
Everybody's making those decisions as the weather gets better and people start gathering.
Hey, Dr. T, did you get your test kit yet?
You know, I am so pleased to say that we got it. Not only the test kit, yeah, came to the house. That's the individual one. But more importantly, our local county health department provided us with rapid test kits and KN95 masks for distribution in the barbershop network. And that's a very exciting part of the work that we're doing out in the field in between these shows. And as you know, what makes these shows run is the crew, the team.
Absolutely. Absolutely. We have a great crew, not just a good crew. We have a great crew. It's the team behind the scenes that really make this show go. Our technical director and slash producer of the show, Meg Jordan, and we're gonna do a little special thing with Meg today, Dr. T. I'm not even told you this, but she's gonna do something really special today.
All right.
Meg Daly, the person that you see all of these graphics and everything and all the promotions, that person is Maggie Daly, and she's assistant technical director. Soraya Khan, who is our media specialist and social media specialist. She works with communications, makes sure that we are on all of these platforms and are seen all over the world. And then Kimberly Fleming, who is our social media person, who also curates when we go into the vignettes and short clips of our show. She and her team put all of that together. And of course, our sound designer, the person who works with the sound, is Elijah Pugh Jr. And that's our team. We got a new person coming on, Dr. T, and we'll talk about that person a little later on. But we got another person coming on the team starting this week, I think.
All right.
Yeah.
What a lineup we have today.
We have a lineup, man. Let me tell you something. We're going back to back home. We started out with Dr. Reed Tucson.
Yeah.
A couple of years, a year ago, when the White House first started our collaboration. It was Dr. Reed Tucson that was the forefront of that, and was one of the greatest advocates for us for our working with the White House with the Shots at the Shop initiative. And this is kind of a spinoff of that initiative. So to bring him back on and to have him engaged is wonderful. And he also was a part of that ad council piece we did. Now, I was telling you, I was in Hawaii at 2 o'clock in the morning. I see us again that they ran that piece in Hawaii the other week. And so that was really good.
You did have the time difference that gives you your reason for being up at 2 a.m.
well, people still up at 2 a.m. in Hawaii. Now, you may go to sleep early because you know how you are, but people still up at 2 a.m. It's like Las Vegas. I mean, that's the time people start going out.
Hey, Mr. Mayor, let me just say one thing about Reed coming onto the show.
Mm-hmm.
Having Blacks Against COVID out there as an advocate, pushing the movement forward, so important. And so we can help amplify what's happening there and what we're doing here.
Absolutely. And he's one of the co-founders of that movement. And it is a movement. And I'm so appreciative to have him. Man, I'm excited that we got youth on the program. We talk about it all the time, but now today it has come to fruition. Najee Graham Henrys, who is the world's youngest female barber.
All right.
And, she's getting a lot of press in the Philadelphia area. And so we're going to be doing a clinic with her and do some shots at the shop with her as one of the principal speakers and principal promoters. And so we're excited about having her on today. And, speaking of going back home, Dr. Ian Moore,
right.
We love him so much. He's now director of pathology at Emory University.
Okay.
And so, he got a new gig. And so he moved back down south. Oh. And so, he's a Tuskegee man. I have to.
Okay.
Clear, right.
I'm sure you've told him where to get a haircut.
Right, absolutely. He's got the hookup. You know how you have to give brother the hookup. Well, we've given him the hookup. He knows where to get the hair.
When he came on this show, he gave all of us the hookup by explaining the coronavirus like you would to a third grader with a model. It was amazing.
Yeah, I will still say that the way that he encapsulated that is the best I've seen so far anywhere from anybody. And that's not to say others have not done it. I think he did it better than anybody else.
Absolutely.
Right.
That's why he's back.
Absolutely. He's back by popular demand. Right?
All right.
Right. So we're excited about all of that. And so let's get started. Let's bring up our buddy first, Dr. Reed Tucson. He is, Dr. Tucson needs no introduction for this format, but he has distinguished himself as a leader in healthcare for his entire career. He's worked at the highest level that you can imagine, but he's always a very humble person. He moved down to the South too. He's in Atlanta, Georgia too. So it's the birds come down south. I don't know why y'all staying up there.
Eli might work on him as well. Let me just say this, man, before we bring him up. I have had the opportunity to work with Dr. Tucson in the early days of the AIDS pandemic, and it's those lessons that we learned there that he's bringing forward in this fight. And I'm just so excited to have him on board tonight.
We love Dr. Reed Tucson. Let's bring him up. Hey, Dr. Tucson, how are you doing, my friend?
Well, I'm just so glad to be with you guys. Thank you so much for having me on. I really appreciate it.
Yeah. Well, again, we're trying to stay vigilant because I think oftentimes when, politicians make, policy that may be antithetical to science. People have to make decisions for how they're going to protect themselves and their families. And so we need to give them the information so that they can make an informed decision. And so that's why we want to kind of have you on today, because every state, as you know, have relaxed all the mandates, public health mitigation mandates. And so, the question is, what you telling your family? Because whatever Dr. Tucson telling his family, that's what I want to know.
Well, thank you. So
whatever
much.
You telling your folk, hook a brother up. Tell me what you
hook a brother up.
I tell you, well, first of all, what I do tell them is I understand that you're tired. Everybody's tired. And the spring is coming. And although it's raining in a lot of parts of the country, the spring is here. The flowers are starting to bloom. And you just want to be back to normal life. There has to be some sense of hope. There has to be a sense of optimism and that, and so I don't want to squash that for anybody in my family, nor for myself. Having said that, though, I do need to let them understand that this ain't over. And I remember most vividly in January, in the middle of January, which is only a couple months ago. You think about it, just a few minutes ago. When everybody was saying that the Omicron variant was no problem. It spread widely, but it didn't cause real illness. No big thing. And let's just roll with it. Things are almost over. What nobody really noticed, because it was Black folks that was suffering, the highest rate of hospitalization in the entire history of the pandemic occurred just a few months ago, January. And everybody else was saying nothing was happening. The highest rate for any group at any time in the pandemic was in the middle of January for the Black community in terms of hospitalization. So I'm always telling my folk, be very careful. The third thing I'm telling them is this, that we've got 2 new variants, but mainly one particularly, the BA2 variant that is devastating across Europe, came through China, rolled through India, and then came to the United Kingdom. We usually get what happens in the United Kingdom 3 weeks after they get it. Mm-hmm. So we're close into that 3-week period. So I'm watching the data very carefully every day to sort of see. But it may be that the variant will turn out, while we know this variant, that the new BA2 variant is much more transmissible than the previous one. It is very true. Right. But what we don't know is, will it make you sicker? And we're still waiting to get more information on that. And here's what we're looking at specifically, and what I'm telling my family, I'm watching to see whether or not previous infections that have produced antibodies will protect us from this new BA2. Right. Or is this new variant particularly skillful at evading the defense mechanisms? It's like, those of you that are football fans, you got a team that's really got a great offense, and it works well. But on the end of the day, you can have a defensive coordinator that can shut it down. Can this new variant have a super genius as a coach who is going to design ways to defeat the defense? And so we're going to watch that very carefully. The last thing I'll say and be done with it is, so what do I do in terms of how do I behave? I am looking, now I'm going to be very specific about 2 things. Number one, the only thing that matters now about the COVID pandemic is what's happening where you live, not the national numbers. It's where you live. So watch and look up in your local health department is reporting every day, what is the transmission rate where you are living in your zip code? And if it is above a certain number, that tells you need to be more cautious. And if it's below a certain number, you can be a little less cautious. So go to your website for your county health department, look at the data for case transmission, look at what they say that how you should interpret it for where you are, the number of cases per 100,000. And mostly what they'll say, if it's below 20, you're going to be all right. But you take a look at what they say. And then the last thing is, if you're going indoors with a bunch of people, and Mayor Omar could not have laid it out better. As everybody else relaxes their vigil, and all these people come in from around the world, and who knows from what state, as this relaxing, and they're not wearing masks, and people working in the grocery store aren't wearing their masks, the workers, you have no idea of what's going on where you are. So if you are not boosted, if you are not boosted, don't go in there. And if you do go into those places, you got to wear your mask. You can't take the risk. And if you are immunocompromised, where you have an immunocompromising disease, or you're taking medicine that makes you immunocompromised, you got to wear your mask. And if you're over 65 with a lot of pre-existing health conditions, you wear your mask. I wore my mask today when I went into the UPS store to pick up my packages.
That's right.
I put it on and I walked on in, no problem. And that's what I'm going to keep doing for a minute. But I'm also going out more. I'm living my life more. I'm out in the woods more. I'm having a good time. I'm enjoying my life. But if I go inside that building, mask on, do my business, and go on back out. I hope in another couple of weeks, we'll be able to tell you, you don't have to worry about anything. But the last word.
You like a preacher, Dr.
Let me tell you, I got to get this. I got to preach this message.
You part of the family, man. Talk as long as you want.
I got to tell you, We got to get these booster doses out. We
Yes.
closed
That's
the
exactly
gap
right.
between
Yes.
white folks
Yeah.
and the rest
Yeah.
of we are
Yeah.
we at the top. We did it
Right.
on the first two on the
There you
primary
go.
series.
That's right.
Right.
But we went straight down the toilet on the booster. And that's what is going to protect us from the new variants coming over from the United Kingdom and all these other people. So that's what I'm saying.
You know what? That was my
But-
question I was about to ask you, Dr. Tucson. I mean,
Okay.
right,
And then I got a question. If you
that
go,
was going to
go.
be my question, because we and Dr. T, I'm gonna give you this right now. Dr. T sent me an article that said that Black people were being disproportionately impacted by COVID now, and that may be why many white people don't see it as being a big deal now, because of who's being impacted.
Well,
mostly.
Two things on that.
Tell us what you're
I'll tell you
talking
what.
Well, just before you go, let me say, because it was a scientific article and then translated into the public press, and it's relevant because of what we're doing, as well as when things become endemic. Right now, this is a pandemic. And Dr. Tucson, you are absolutely right. These variants will continue to be spun off as long as this virus is alive anywhere in the world in a human being. So this is still a pandemic. But at some point, we're going to be hearing this term endemic. And if you can help our listeners there, that would be good. And that's our concern. When it becomes endemic and this data that the mayor is describing becomes, oh, it's them, it's their problem. You see what I'm saying?
Yeah. No, I'll tell you. So I'll be real brief because I know you got other guests. So let me just do them real fast. Number one, the first one with the mayor. Mayor, I think that as we think about, and I tell you this, I've stopped doing too much thinking about white folks. I'm gonna be honest with you. I ain't got that much time in the day. I'm trying to live my life and save my people. But this is what we do need to know. When it comes to Black life, and we are so disproportionately rated in those statistics, you're right, they don't care. But this is what's the scary part. They don't care about their own lives. It has been the most incredible thing to see these dominant white politicians literally say, I don't care that these seniors are dying from this disease. They are not more important than opening up the stove. We would trade off those deaths to make sure that nothing happens to this economy. It's the money. It's always going to be the money. So the callous disregard for human life is the thing that scares me the most. I'm not going to wear my mask because of some political agenda. That political agenda is more important than whether I kill people. We're going to get to 1 million people in this country dying from a disease where the overwhelming majority of them did not have to die.
Yeah.
And it's going to happen because they simply don't care. So the only reason why I would bother myself, Mayor, with how so-called white people think in terms of those in power, it is, I have to, because they are in power and they're making the decision. So I got to care. So we have to keep infusing the conversation, Mayor, over and over again with a love for all life, a love for people, a love for human beings. This country has grown callous, and we got to bring some humanity back to it. And then quickly with Stephen, your question about endemic versus pandemic, people are asking, what's going to happen? How long is this going on? Is this going to go on forever?
All right.
We can't predict. It'll be like the flu, I think. And that's the closest you can get. You're going to have ups and downs. It'll pop up, it'll go away, it'll come. We will have vaccines that we will be using on a regular basis to protect us as we get more. So it'll be a part of our lives. And it's not going to disappear, unfortunately. So it'll be there. And what our jobs is to learn to live with it, just like we learned to live with flu and other things. And what it ultimately persuades is, Dr. Thomas, and I know you and the mayor agree, we got to go back now and start dealing with Black health. All of the elements.
Save ourselves.
Yeah.
We got to go back to that. And that's the agenda going forward.
Right.
Okay.
I agree.
We got the game plan.
Man, we got it, man. Thank you
Now we
so
gotta
much.
implement.
Thank you all so much for having me on. And I didn't want to take too much time away from
No.
Thank
All
you.
of that's good. That's all that's good, man.
We got some new friends for you.
I want to introduce you to Dr. Ian Moore. I don't know if you know him, Dr. Tucson, but he's in Atlanta now at Emory University. He's a graduate of Tuskegee University.
All right.
And so, he's got the power, right? So, but we're so happy to have him. He's a friend of the Cutting Edge Show. and we consider him family. Dr. Ian Moore, how you doing, man?
I'm doing pretty good. I will go ahead and preface it by saying I am congested thank goodness, because of allergies. I moved back south. I used a blower yesterday, and a yellow cloud just filled the air. So I knew that I said this is perfect timing for me to get on and talk, because I'm gonna talk about COVID, but I'm going to be sneezing and coughing while I'm doing it. So perfect timing. Perfect.
Hey, brother, it's nice to meet you. And I tell you one thing that's so important. And Stephen and the mayor and I, we've learned this over and over again in this pandemic, and that is Black scientists of excellence. Their faces need to be brought to the Black community every day. And most Black people have no idea how many of our people are in those labs developing the science, and who are there in the regulatory bodies at the FDA and so forth. So, Ian, man, for you to have your knowledge, your background, and being out here with the people, thank you, brother. I really appreciate you, man. I'm sorry I have to go give another talk, but I love you, man.
Hey, I appreciate it. Thank you.
Thank you so much.
Thanks, Reed.
Thanks for
appreciate it.
Dr. Reed Tucson, ladies and gentlemen.
Let's give him some snaps for you out of here.
Absolutely.
For the record.
Thank you so much for joining with us. We love Dr. Reed Tucson. He's really a powerful dude. Tell people your background, because a lot of people may not know that you were a part of the initial team in developing the drugs that we are now call them drugs. I guess
vaccines.
Vaccines.
Moderna in particular.
And Moderna, right? So tell people the background. Your background.
Well, yeah, and so to Dr. Tuckson's point, he hit it right on hit the nail right on the head. A lot of people don't know that one of the lead scientists, actually one of the premier scientists in the development of the Moderna vaccine platform, was Dr. Kizzmekia Corbett, who was a very young, intelligent Black woman who is now has her own lab at Harvard. So we're mixed all throughout this process. I did all the preclinical studies for safety and efficacy studies for the Moderna vaccine. So when it was in its early stages before it went into people, and ultimately moving it along to phase 1, 2, and 3 clinical trials, and then emergency use authorization for the FDA. So that's kind of my role. I'm a veterinary pathologist by training, but my background is virology and immunology. I work with flu viruses. So when you were talking about flu and we were talking about endemic versus pandemic, this will absolutely evolve into an endemic process. We will be used to it. It'll wax and wane, like we were talking about. Honestly, we need to start shifting gears and start thinking about how to prepare, because this has been the revelation for a lot of people. It's funny because I do want to make this point. Earlier in this pandemic, when I first started talking to people, it was in steps. It was trying to prove to people that this was real. Then it was trying to prove to people that the virus could hurt you. Then it was so it's like all these evolutions, the iterations of trying to convince somebody. But it's like being a kid. I have 2 kids. I have 2 boys. Okay. They get in arguments all the time. And they're huffing and puffing and fold their arms and walk away. It's hard to be mad when you're by yourself. Okay. And I say that because if at this point in this pandemic, there are people who had this certain perspective, have a certain political persuasion, and they like, this is not real. I'm not going to believe it. You can fold your arms all you want to, but the world keeps moving. People start to have to adapt, evolve. And you're still over in the corner with your nose in the corner with your arms folded. But this virus right now, this BA2 that we're just talking about, it is more infectious than the previous version of the Omicron variant. And so you cannot be vaccinated if you want to, but you're putting yourself at risk for no reason, because now nobody has grown an extra leg, nobody has developed an extra head from getting vaccinated. We are 2 years into this, and we are over a year of people getting vaccinated, getting boosted, and there's nothing to report. And there are people who are walking around and protected, and you can join that group, or you can hold on now just for the sake of holding on. I mean, sometimes you have to some people just like to get themselves in trouble.
Dr. Moore, yeah. I really like the analogy of the huffing and the puffing as the world moves on.
Yeah. Yes.
And
He put it where the
so
cows can get it, Dr.
he did. He definitely did. And that's why I wanted him to stay on this a little bit longer
Yeah.
about this notion of endemic.
Yeah.
And the kind of calculus that now we need to make as people start gathering.
Yeah. Yeah. So there are so many directions that we could take with this. I mean,
And just one other thing, that since we're comparing it to the flu,
yes,
the flu doesn't cause type 2 diabetes, but COVID does. The flu doesn't cause a whole range of other organ system damage. So we need to make sure that people don't think it's like the flu or the common cold. In other words, don't play with it. You don't want it if you can avoid it, right?
Yeah, exactly. The only similarity between this and the flu is that it eventually will be something that happens periodically. That's the only similarity, and they're both viruses. That's about it. But they are very different in their ability to cause disease. Flu viruses typically, and don't get me wrong, we're playing around with fire. There's a group at NIH. As I mentioned, I'm at Emory now, and so I'm the director of pathology in one of the research divisions. But there are groups at NIH and others who are working now on what they call pre-pandemic preparedness. They're trying to prepare for taking the pathogens out there, the bugs, the viruses, and stuff that are out there that are the ones that are at greatest risk for doing what COVID did to us this time.
Yes.
And they're already trying to plan and have stuff in place so that if it does, a vaccine can be developed quickly and a vaccine can be effective. And we don't have to go through this because, as Dr. Tucson just mentioned, we have 1 million people almost that are going to have died from something that a fraction of them probably should have, at the most, a fraction of them could have succumbed to the disease. But at this point now, because of attitudes and because of decisions, because of poor information, they made decisions that ultimately hurt themselves and hurt their families. Yeah. So
we proved we can make a vaccine. We haven't proved we can get people vaccinated through the entire series and the booster. Yeah. And that's why we have to stay the course right here on the cutting edge. Would you agree? That's why we want you to keep coming back.
Right? Absolutely. Right. And one last point, especially about the boosters. Dr. Tucson mentioned boosters as well. There's an article that was just recently published in New England Journal of Medicine that showed that after you have your normal first series of COVID vaccines, the antibodies that are in your blood at that time that can neutralize this new variant are 20 times lower if you don't get boosted. But if you get a booster, those antibodies that help fight the virus, help block it from attacking, now this virus that is more infectious, that can attach to your cells easier, you get 20 times more protection after you get boosted versus the opposite. If you just go with your normal series and your immunity starts to wane, you're much more susceptible to potentially getting infected with the Omicron 2. Now, you still would have some protection, but you don't want to risk getting sick, but just get that booster. And now you're in a situation where you can help fight this off very effectively and efficiently. And I'm preaching to the choir at this point, but I'm in the pulpit because I got exposed to COVID shortly after moving to Georgia. Wow. And I had a runny nose. That was it. Okay. That was a runny nose, and that was it. But I thank God, first of all. But then I thank the fact that I was vaccinated and I was boosted, recently boosted before I came down, and so I had nothing really to worry about other than just trying to keep swabbing and checking until I was negative.
Okay,
right. So that was it.
Right. So we're going to talk about today boosting the booster.
There we go.
Campaign, because we really need to, just as aggressively as we went out trying to get people vaccinated initially, we have to re-engage that energy in getting people boosted, particularly the most vulnerable, people 50 and over, immunocompromised, etc. Those are things we got to get people to understand it's not over.
Right.
And that's critically important. Dr. Moore, hang out with us because we're gonna have this conversation today. But I want to bring on the world's youngest female barber. I mean, can you imagine that?
Oh man,
That when we
so
get the
excited to have her with
youngest,
us.
and she's just as cute as pie.
There we go.
And you know, I was so excited. I've been talking with her mother off and on. She lives in Philadelphia.
Okay.
And when I first was introduced to her, to know that someone could commit their lives early,
Yes,
to a profession that's so noble as being a barber, I think that that's special.
yes.
And she is special. Najee Graham Henrys
All right, here she comes.
is our guest for today. Hey, how are you doing?
I'm good. How are you?
Good. We are so excited about it. You know, you are a celebrity. You know, we are seeing you all over the newspaper, and people are writing about you. Tell me, how did you come to the space where you wanted to be a barber?
Like how it all started?
Yeah, tell me how you started.
Well, basically, it all started when my mom saw this thing on Instagram. It was a barber orientation, and she enrolled my brother in it. My brother tried it, and he didn't want to do it. So then when I got back home from school one day, I saw my mom looking at the pictures from the orientation, and I said I wanted to do it. And yeah, so that's pretty much how it all started.
Wonderful. So your brother missed out on it. Now
Oh,
you getting all this
boy.
prep. Now, is he a little jealous that you getting all this attention?
Nope.
he still didn't want to do it. So you ended up really taking it seriously, and as a consequence, you are now trying to leverage that spirit of being a barber into getting people protected through COVID-19. I do know that you all are interested in doing a shots at the shop, or a what do you call it, Doc?
A vaccination clinic.
Vaccination clinic. That's what I was thinking.
And we make it like a festival.
Right. We are going to help you do that. Right. So you're going to get our support in helping you put a vaccination clinic together. We know that Stacy Ruffin with Rejuvenate is going to be your space that you're going to be doing it. So we're going to work with her. She's a regular. She's a part of the Cutting Edge show, and so we're gonna do that. Is your mom there?
Yes, I'm here.
And say hello to me. Where are you gonna be?
Hello, Mayor Neal. Hello, panelists.
Good. Now tell us about how you know you and your daughter have kept this thing going. It's not a fad. This is something that you are committed to.
Right. So once we completed the course, I just kind of gauged her attitude to see, where she wanted to go. And she's been pushing me. So it's, although she's just 11, it's pretty much my responsibility for her to find opportunities for her to cut.
And how poised she is.
Yes.
I mean, at
Steady
11
hands,
years old,
right?
it's like incredible. I mean, for her to be as articulate,
yes,
and clear minded in terms of her goals. I mean, I'm so excited about it. We need role models like her.
That's right.
And so we're going to, we were talking about it today. We're going to do a special show with just young people.
Okay.
And we want you to be one of our special guests.
Absolutely.
And we're going to bring young people in from all over the country, right? And we're going to show it's going to be strictly geared toward and directed towards young people.
Nice. Thank you.
And Mayor, you talked about role models. And I want to say something about Mom. Thank you for listening to her and letting her follow her dream and you supporting her. Yes. That's so important for you both to be here together.
Thank you.
And so you're going to meet some new friends. Think about the Cutting Edge as a solution space. You're going to meet the people that help you make it to that next step.
Thank you.
Good. Let's bring up Stacy Ruffin with Rejuvenate because she's going to be one of our you know, she's a part of us, but she's going to help facilitate what we're doing.
Okay, here we go.
Stacy, how you doing, sweetie?
Absolutely amazing. Hi, everybody. I'm super excited, not only for the young barber, because we have a barbershop and I have a barbershop and a hair salon. So it's going to be, I got them all hyped up about her coming and talking to our mother for so long. We've been trying. I said, call everybody. And I've been, you know, in contact with her mother for a while. And I just told her, just keep contacting them, keep contacting them. And I'm super excited that she got through so she could have, I told her any day she needed. I said, we're open for it. I said, this will be our third one at Rejuvenate. I did one, Sandy did one, and now she'll be the third one at Rejuvenate. So we could do 4, 5, 6, or how many it takes to get everybody vaccinated and boosted.
Mm-hmm.
So
Stacy, say something about your clinical partner. If it's been one or more, who's been that clinical partners that showed up?
The first one we had Giant. They came out, and then we had the second one that I did. Walmart came out. So, and I was telling her, you know, just, you know, keep going at them and see who, you know, will come back out. We were supposed to have the Black doctors to do it for a third one. So maybe, you know, they'll be able to come back out and do hers, because I want to make it, we have a big space, amazing salon and barbershop and spa. We pretty much could do what we need to do to bring the attention, you know, to everybody, because the residents, we have 3,000 people at our residence. So, and they all keep saying, when you giving it back? You know, I think a lot of them need the booster.
Right.
So,
right.
A booster party.
Right. That's what we need to do. I mean, obviously there are those who've not gotten the first shot, so we really want to do that. But we also want to boost the booster. But I am concerned, and we don't have the statistics now, but I got the staff looking it up. How many young people have not been yet vaccinated who are eligible? That's right. We do know from 5 up now you can get vaccinated. I'm trying to see if we can get some kind of measure on the number of young people who are vaccinated and the ones who are not, and see if we can use, you know, person like Najee to, you know, to be that spokesperson for young people, you know, and promote her nationally. I'm not talking about, you know, just in the Philadelphia area or just on, you know, the Cutting Edge show. I mean, we can make an ad with the ad council and really just have her be the spokesperson to get young people vaccinated. I think that'll be important.
And I noticed that Najee has followers on her social media. I'm trying to get some followers. You think you can help us?
She's got it going. She's got it going on.
Followers.
I mean, she's got it going on. I'm talking about, I did my research on her, man. And I'm saying she's already a celebrity, man. You know, so we're so excited to have you on, and your mother's incredible. I just want you to know, truly love you and your spirit. So thank you so much for contacting us. You know, we are so appreciative. Stay there. We're gonna do something.
Yeah, stay with us. And Stacy, we'll use all our weight.
Okay.
To help.
I have
you know, sometimes a phone call wake folk up. We've heard that more than once, and so we'll make sure you get a clinical partner,
and you'll get everything you need, and we'll make sure that we get media stuff and all of that involved. Okay. Thanks, Stacy. Don't go nowhere. Too. You know, we'll bring you back. Meg, come up. This is what I was telling you I was going to do. You know, Dr. T, I think that you have been, you know, getting these kits, and I don't know whether or not you are using them, right? Just like you got people who've gotten these home testing kits
Yeah.
for COVID,
Rapid
and
test.
the rapid test, right? And they've never used them, right?
Holding on to them.
They're holding on to them, right? And I think it's, it's intimidating. They don't know what to do. So what we're going to do is live on the cutting edge.
Yeah, there we go.
I mean, first ever done.
Here we go.
Meg is going to take us through the kit, and she's going to actually perform her own tests and give us the results live.
Here we go. We need to play music for this one.
Yeah. Meg, so tell them what you're doing and how it's done.
Wow.
Okay. So this is one of the COVID-19 test kits that I got from my government for test kits. So these are the iHealth ones. In these iHealth ones, you get 2 kits per box. And like I said a couple weeks ago, the reason you get 2 kits per box is because you probably need to test twice. Rapid tests are really good at figuring out when you're positive. Sometimes they can give you false negatives. Sorry, the test tube's at the bottom of the box.
Okay.
So you have 2 full test kits. So all you need is a card. You open that first, and it looks like this.
Okay.
So you've got your dropper area here, and this is what you'll actually read. If you've ever done a pregnancy test, it's kind of like that, those 2 lines.
Okay.
Andre's laughing. What Andre laughing for?
Because he's never done a pregnancy test. That's probably what it is. That's probably why he's laughing. Go ahead.
All right, Meg.
Okay.
I've seen them.
No, yeah, right.
Close your mic.
You've
Close your
had some
mic.
positives before too.
So
Go
you've
ahead.
got a test tube, and it's got a lid. This lid is kind of a double lid. I'll show you that in a second. They give you a tube of liquid. So you got to cut this open. And this is kind of like a turkey baster. And you've got your liquid, and it has 2 lines down here at the bottom. What I do is I just pour all this liquid that's in here into your test tube, because if there's not enough liquid in here, it can give you a false negative.
Okay.
And what's false negative mean?
It means that you actually do have COVID, but your test says that you don't.
Okay.
So
Good.
you think you're fine.
But you're
bad.
not. Okay.
Right. So, so you've got your test tube. I put the lid on because these bottoms are not super great. So you've got your test tube ready to go. Okay. Now you're going to take your swab and pop it open. Don't touch the Q-tip end. You can mess up your test that way. Hold it from the bottom.
Right.
And then you stick it in your nose.
All right.
In your nose.
In your nose. Yeah.
How far up? How far up?
So until about here, you
Okay.
got that bend in your nose. So
Right.
it's
Okay.
go about 3/4.
Just go about, okay, up
Where
to
your
the
glasses
bend.
way. There
Yep.
we
Go
go.
up to the bend, but where your glasses come up, right in there area. Okay.
Yeah,
You don't have to
everybody
go
made
up in your head.
that. Some people's a straight shot.
For the
Are you
original
doing?
tests,
You're doing both noses?
you have to do both sides of your nose. And what I'm doing, I stick it in and I circle it 1, 2, 3, 4, 5. Because I'm paranoid, I hold it for 5 seconds to make sure that I actually have all my tests on there. So then you've got your swab, your test tube. It says to bang it on the table. I don't know why, but it says to bang it on the table before you put the swab in. Put your swab in and you swirl it around down in the liquid 15 times.
Da, da, da,
Yeah, that's what they say.
da.
We told people rapid tests, and right now I'm realizing it's not as rapid as people are going to think.
It's rapid.
Yeah.
Yes, it's rapid.
We're adjusting expectations. I think it's very helpful.
Comparatively speaking, Dr. T,
Absolutely. 24 hours or 48 or a week.
Right.
Now what you got to do is you got to pinch the bottom of the tube. These are flexible. Pinch
Okay.
the bottom of the tube and like a sponge. You got to wring all that liquid out of there because you're trying to get all what was in your nose in that test tube, because that's how you're going to get a good test. You can throw away the swab. You're going to put the cap back on. And now it's got a weird little clear cap. that you have to remove because this turns it into a dropper.
Okay.
Now you've got your card. What you're going to do is you're going to put the liquid in this well. So put it back flat
In
on
the
table.
smaller one. In the
Mhm.
smaller one. Okay.
The little one, because you're going to watch it. Unfortunately, I can't show you on camera, but it's going to bleed over. Like,
Okay.
it's like, think about a piece of paper absorbing water. It like spreads all the way down the paper. That's
Right.
what it's doing. It's chemically
Okay.
absorbing.
Okay.
You put those drops in.
You squeeze it all in?
Ooh, 3 drops.
Okay.
3 drops.
In here. And now you wait. So I'm going to set a timer. And then you look at it when it's been 15 minutes.
Okay.
And you have to look at it before 30 minutes. If you look at it after it's been 30 minutes, the test might be wrong. The ink might have bled. So
Okay.
that's why it's important.
So what we're going to put 15 minutes on, and tell us when we're going to bring you back in 15 minutes, and we're going to see what
Right.
happens. Right.
Sounds good.
Keep your fingers crossed. We hope that everything comes out
please.
okay.
You know, Dr. Moore, just watching that.
Thanks, Meg.
Thank you so much, Meg. And Meg's really good at keeping each step of the way. And again, one of the things the mayor says is how you set the expectation determines who's going to embrace the cause. We want our community to embrace the cause of rapid tests before you're going to an event, before you're going to choir practice. But if you saw all the ways in which you could mess it up and get a false negative. So those kinds of basic instructions, I can't wait for Naja to be on the screen, Omar, Mr. Mayor,
Yeah.
and help explain it to her folk, because her age group would also be able to take a rapid test.
Right. And we'll have young people performing just like Meg did, right?
That's right.
Do the rapid test. So we're gonna, we want you to know, young lady, that you are part of the cutting edge. You got that?
Okay.
I want you to know that you're an integral part of us, right? So I want you to hang out with us. All right. All right. Let me bring up Sandra Jenkins. We need to talk to her and see what's going on. What do you think about all of what we've experienced today? Well, the first thing, how are you doing? What's going on?
I'm doing really, really good tonight. Yeah, it's a good night, although the weather is pretty inclement out there right now.
Oh, wow.
The winds, yes, pretty strong. Yeah.
Good.
Yeah.
So tell us what's going on in your world, and tell us, this is something that obviously we need to do, is to engage young people more.
Mm-hmm.
Not in terms of just, peripherally, but intentionally engaging them in the process.
Absolutely. That is really the nucleus of this, the purpose of this is to save our children. The pandemic has taken a major toll over the young people by far. And some of the young people that I see regularly, they are right now looking up to their elders, okay, to lead them in the right path. And the right path is to be able to provide, a safe space for them. So that is really essential when you're addressing the issue involving the pandemic and young people. The young lady that we have here, Najee, I just want to thank you so very much for looking into this industry and finding yourself. That is so very important. Who knows? You can probably end up becoming the most famous barber by far
in the whole United States world kingdom.
Absolutely,
it's everywhere.
absolutely.
Knowing your history matters, and that
yes.
Madam C.J. Walker, the very first millionaire in America who was a Black woman, that can happen.
Absolutely, and I just want to let you know, young lady, I'm just around the corner, so please reach out to me. I would like to meet you personally because I see something very gifted and very special to you. And you could be just a wonderful role model to some of the other young people that are really right now are concerned about their well-being. There are many students that have taken a lead during camp programs locally in our communities that are needing to know and hear the voices of, people like yourself, young people like yourself, to share your knowledge. So I commend you. And by far the parent is very important factor. So thank you, Mom. Thank you so much.
Absolutely, Mom.
Mom's got it going on.
Yes.
She's the bomb.com. I'm
There
telling
we
you.
go.
And you're going to do a fantastic job at Rejuvenate. Rejuvenate has the space for you to be able to provide an excellent vaccine clinic. Ms. Ruffin, who is the owner of Rejuvenate, we work together, and this is what I brought into the Rejuvenate community. So I'm glad that Stacy is continuing this initiative, because this is just something that is going to be an ongoing process, and that is the endemic that we're living in today.
Yeah, you're right. Well, we are so appreciative of you.
You're welcome.
To have you be a part of the cutting edge. Dr. Carol Ritter, we have had a resident physician with us the entire time.
Absolutely.
That we've been on. And in the person of Dr. Carol Ritter, she's an OBGYN physician, and she hails somewhere up there in Maryland. I don't know.
The great city of Baltimore.
Oh, man.
Baltimore.
Everybody's Maryland. Man, I don't know about y'all. But anyway, Carol. Dr. Carol Ritter is such a special person. And we tell her we love her all the time, but we can't tell her enough. So we're going to tell you, we love you, Dr. Ritter. And how are you doing? And what do you think about Najee? We got her.
Right.
We got Dr. Ian Moore back.
Right.
We have Dr. Reed Tucson here.
Right,
I mean,
goodness.
we got everybody. Tell us what's going on in your world. And then we're going to talk about how do we now kind of rejuvenate, resuscitate,
like
that booster that booster conversation.
Right. It was great to hear Dr. Tucson. His points on the virus at this point were great. I mean, the FDA is still struggling and grappling with the strategy of what to do on the timeline here with this new booster, because these new variants have shown now that they're eroding some of the existing vaccine processes. So these are our scientists speaking this way. And I listen to the scientists. I don't listen to the politicians as much as I listen to the scientists now.
I don't know why you listen to them at all. I listen to the scientists.
I have to because otherwise I'd lose my medical license.
Yeah, right. Okay. Yeah.
Right. Because the law, they have the law. But, we've come a long way from this testing point of view, which I was just watching Meg do this, because in the beginning we didn't have the tests, right?
That's right.
And you can't really follow the virus unless you know the numbers. And even now with all these testing, if you come positive, you don't report it. So we still don't have really good numbers of what's happening with the positive rates out there when you talk to your health center. But I love the fact that we have the young barber on, because, it shows us that, the young are taking hold of their own destiny.
Right.
Yes.
I mean, you take hold of your own destiny and how you look, how your hair looks, but you also take hold of your own destiny and how you feel to do these tests and take ownership of, where are you going to go and how are you going to expose yourself? I'm a gynecologist, so I look at the safe space from a sexual health point of view, and I teach that to young women all the time. But this respiratory virus, HIV and HPV are not respiratory. So this respiratory virus has taken us to a new level of intercourse.
Yes.
Yes.
Wow. Who are we going to be safe with?
Right.
We do it one-on-one, but now we have to do it in the community. As Dr. T says, we share our air.
Yeah.
We have intercourse with each other by breathing each other's air. So wear your mask if you're not boosted.
Wear your respiratory protection. And the other thing that we've learned is that you can actually improve the air quality in your space with a Corsi Rosenthal box. And Ian, I think you will love this whole notion of building something that can actually clean the air and take 99.9% of particles out of the air. And you're a scientist, so you know how important they are.
Right. Well, let's show some of these colorful boxes. Look at what they're doing.
I was out with Meg today delivering the boxes to the barbershops, and Meg, bring Meg in.
Yep.
And taking them to Lutheran services that serves refugee families, taking them to the LGBT Center in Washington, D.C. And as we walked in, they became these conversation pieces. As you can see here in the upper left, the security guard said, "Hey, what is that? How do I get one? Can we exchange information?" And that's what we need to be doing right now to keep the conversation going. This is actually how you can clean COVID out of the air where you are.
And you don't have to buy the $600 machine.
$600. They got a lot more zeros behind it than that. And some of them are industrial. These are the filters. If you're lucky to have one, it's a privilege to be in a building with other people, and there are filters there. Most people don't have that. Here's how we bring that right down to the community level.
I wanted, Dr. Moore, when you talk about HVAC systems, and we know that in communities that are, deprived of finances, a lot of times schools and other places don't have those sophisticated HVAC systems that Dr. T is mentioning. How do we substitute when you're not in that kind of space? And then the second thing I wanted to say, we talked about, they call it herd immunity. We say community immunity here. Are we getting close to this kind of community immunity based on the fact that so many people have contracted COVID? That maybe it's more people that have some natural immunity in conjunction with the vaccine?
Well, to your first point, I think that and you say it's a Corsi Rosenthal. Is that what
the Corsi Rosenthal filters?
That's actually pretty cool, because I mean, now that's my first time seeing that, but just from what I saw, literally it looks like a box fan. That's
a box fan on top that would suck the air in, up and out.
It's faced up.
That's right.
Up, and then it pulls the air in through the filter.
There you go. And then the bottom is covered. And so here's one of the things I wanted to say to you, because when you first came on the show, you brought the model that you built for your kids. The decorations that you saw on that, it's filters and duct tape and a box fan. But they were middle school students at College Park Academy, 6th, 7th, and 8th grade science class, working with my undergrads to decorate those boxes. And there are stories all over them. And that's when we saw a spark of, how does science work? How does this work? How do I get into college? Those conversations took place right there. We need more things like that to do what Reed Tucson, Dr. Tucson says we have to do: save ourselves, meaning save our communities.
Yeah.
And building those boxes and putting them in churches and funeral homes and barbershops and salons, and decorating them in ways that they become priceless pieces of art, people will keep them and remember where we were and why we did what we did at this moment.
Well,
I completely agree. Completely agree.
That's powerful. How are we close to this community immunity, Dr. Moore, or where are we with this? And then at some juncture, I want to talk about the long hauler
there you
effect, go. Because I think that people say, just because I didn't die, doesn't mean that it means that I'm okay. And that's we find that. Go ahead.
Yeah. Well, no. So you said community immunity, and I and that term to me now, in theory, let's go back. Let's take COVID out the picture. Community immunity, or as the lesser desired term, herd immunity, herd health, or herd immunity.
He is a veterinarian, so I get it.
Yeah,
I know I have
you
to use it. I have to use
I
it.
just didn't want to be a cow today. That's all.
And we
Hey,
learned so much from the vets.
Hey, if only we could be sheep in this case, and we will follow the leader and go ahead and do what we need to do.
Absolutely.
But I'll step out on that.
You digress a moment.
But but community immunity only works when the antibodies you generate from a previous infection protect you. In this case, we're saying right now that BA.2 variant has the ability, because of its level of infectiousness. Now, as Dr. Tucson mentioned, it's not necessarily shown, or we don't know yet whether or not it's more serious, whether it causes more severe disease, but it is definitely much more infectious. And so if you have the ability for a virus to evade your immunity, then your community immunity is null and void. So that's why the booster is important. If the virus infection or our initial infections had not changed and it was just one variant and we were vaccinated against it, perhaps overall a number of people between vaccinations and infections, you would have enough protection where the virus wouldn't have a door to knock on, wouldn't have a house to go into. But because it can keep changing, it changes its key. So it's like it's like a janitor walking around with a ring key, and it's just checking locks, and eventually it gets in, and then boom, it's all over again. And so that's why we have to get people vaccinated, because we keep giving it the ability to generate a new key, therefore get new access, therefore cause potential to cause a new iteration of the pandemic. And so that's where Omicron BA.2 came from. If everybody was vaccinated back when we had, the Washington strain, we probably wouldn't even be having this conversation. Our conversation would be on diabetes or high blood pressure right now. Wow. Because this pandemic would be almost over.
So you're saying that if people had taken it seriously, if it was not politicized,
weaponized,
probably weaponized, we probably in all the disinformation and misinformation that was spewed, right, through all of the media, to include some media outlets, not just social media, right? We could probably will have avoided a lot of what we're going through now, is what you're saying.
Yeah, absolutely. I mean,
and you're saying that unequivocally, Dr. Moore, right?
Unequivocally. I mean, there are many people who either got sick or who actually died from this disease that didn't have to. I mean, that's understated. Even when I say many, I mean it's a fraction of the people. If this had been taken,
thousands,
maybe by the hundreds of thousands, potentially.
Wow.
So one of the things that you did tonight again is give us good metaphors. I think the notion of the key, the master key, and the janitor with the master key is a very good metaphor to help encourage boosters in our community.
Exactly.
And I want to encourage any of the barbers and stylists out there, and Dr. Ritter, when you're talking with your patient populations, how are you explaining this to them so that it's not just a mandate, but it's a conversation, it's a persuasion. Persuasion can still work.
Is that for me or Dr. Ritter?
Oh, I'll jump in. It basically is a very difficult conversation, and Dr. Tucson really basically said that he didn't want to think about white people, and I totally understand that, because I am seeing this as more of a problem in my white community now, with saying, why do you care? You're boosted and I'm fine. But for the most part, it is a conversation of individual rights over the common good and the common population. So if they're living in a population that they're good in, and they've never really been in any other community that they haven't thought about, they're good. So it's a common good issue right now. And some people, I have to have let them go. I mean, I hate to say that, but I don't like to let people go, but it is a Buddhist thing to detach from them. But I try. And then if you push too hard, you don't get anywhere. And then, so it's no good for anybody, but it's a common good.
Right.
One of the things, and we talked about it before, is this
and let me just say, we got test results ready. But go ahead.
Okay, we're gonna go right to test results because we want to get it.
I didn't want to get past that little window.
Yeah. Let me say this. when people become so selfish, and that's what public health is about. It is not about my individual health.
That's right.
It's about our collective health.
Right.
And I think what we have to do is educate people about public health and why it's important, because I think people are conflating my autonomy, my physical autonomy or whatever with the fact that this is a public health pandemic.
That's right.
That's impacting everyone, and people can die as a result of behaviors that are antithetical to our collective best interest.
There we go.
So I'm going to use that as a commentary. I'm not going to ask the question on that. I'll leave it for that. That's a personal commentary, and the views that were just established are not the views of the Cutting Edge Show, but Mayor Omar Neal. All right, here we go.
Come on, Meg. What do we have?
All right. So I am at 20 minutes, and I am negative.
Because there's nothing there, no colors there. That's why.
Thank you. I
Okay,
can have
we'll
my date
first.
this weekend. So you see the C line and there's a T line. This C line tells you that the test is working. Because what if we had a test that had no lines that showed up at all when you used it? You wouldn't know if that was a dead test or not.
Okay.
So you might think you're negative, but the test's broken. So this one, that's your control line. And then the T is the test line. So since there's no line there, if there had even been a faint line, if I could even tell where that line is on a test, I consider it positive, right?
Okay.
So if you're negative, but you feel sick tomorrow, do it again. You got 2 tests in that kit. If you tested positive, get your mask back on, tell your roommates, tell everybody you live with, tell everybody you've seen in the past week, and stay home. Call your doctor, tell your doctor that you're positive. Your doctor might have you come take a PCR. Your doctor might have to call the health department by law and tell them that you are positive. So don't just throw it in the trash. There's a lot you have to do if you've got a positive test.
So part of that community immunity and community responsibility is to go ahead and do exactly what Meg has just said, because right now we're flying blind in terms of the numbers, and they've stopped even putting them in the newspaper here. So you have to go and search for the good sites. We'll make sure that the people in this show have the most accurate set of numbers available, but it's getting more and more difficult. Thank you so much, Meg.
Meg, thank you. Let's give Meg some snaps. We love Meg.
Come on, let's give it up.
Thanks, Meg. Thanks, man. Positive. That's just so wonderful. Let's do this. We got to do our testing, how we feel, collectively feel. Let's do the word cloud. Dr. T, tee it up. Dr. T, tee it up.
I want you to think of that word that best describes how you're feeling right now at this time in the pandemic. And you're going to type it into the chat, those of you out there on Facebook and social media. And just for the next 30 seconds, keep putting those words in one at a time.
Many as you want.
Many as you want. And we have a team that's going to show us the results. And one of the things that we'll see is the more people that put a word in, the bigger that word will be. So just keep those words coming in.
Just keep them. And for those of you who are out there in the social media space, just to put them in, because we're curating those spaces as well.
Absolutely.
And we're going to add those in, and we'll see how we collectively feel. Let's bring up Andre. I got a chance to go and hang out with Andre.
In Atlanta?
In Atlanta, man. Well, I went by his shop, man. Let me tell you something. You're talking about a brother that is balling and shot calling, right? That's Andre.
You went down and kicked the tires.
I went down to kick the tires, man. It was just coming back from Hawaii, so I had to go by.
All right.
And hang out with Andre. A beautiful barbershop right there on the North Terminal, right across from where you pick up your baggage claim. So we were able to go there, and then Trina went and was able to at least take the photo of, it was closed during that time, but she was able to take the photo of the barbershop and salon right there in Atlanta airport. And so, ladies and gentlemen, please join me in welcoming.
Thank you very much, sir. Yeah, you're doing fine. Thank you very much.
Is this
you missed a picture of the gold walls. You're supposed to always take that.
Oh
picture.
Lord. Okay, now. You know, you can't please a brother. I'm telling you. No,
but Andre's shop, you know, at Andre's shop and the work he's done with his clinical partners, he has had more than one, and they've used that mall space in San Diego. It's a beautiful space, and they've done over 1,000 vaccinations. Dr. Moore, Dr. Ritter, over 1,000 vaccinations. It's not just the number of shots in arms, it's the hearts and minds that gets changed. It's the recognition that you can come to the barbershop and get services. That's also part of what we need to be measuring, Mr. Mayor.
Yeah. Well, let me tell you something. Andre Russell is an integral part of who we are and what we've done. He's been there, and you say, brother, that stick and stay. He's that kind of brother. And so we are appreciative of him and all that he's doing. And he's even talking about, you know, well, after COVID, and we're not focused on COVID, how can I parlay what we're doing into other areas where Black people have other issues as well?
Right. That's right.
And so we can continue this this movement. So I assume now you committed to that now, Andre, right?
Absolutely, sir. Absolutely. And Dr. Moore, I don't know if you've heard about us yet, but we've been working with Emory for the last 10 years on various things. So, you know, high blood pressure, saving organs, things like that. Because, you know, we went through a thing where if you were a person of color, you did not want to put on your driver's license that you would donate your organs, because people thought that if you put that on there, they wouldn't try to save you. So we went through a whole thing of that. But there are two things that I wanted to go, because I know I don't have a lot of time.
You notice you say that I was going to give you notice. I brought you in before the last 30 seconds, right?
Yes, you did. Yes, you did.
Okay.
However,
go ahead.
I have to get used to that. But I did want to say the young person, Najee.
Yes.
You know, I've said this before, because within our shops over the last 15, 20 years, we've had people that come in and do sweeping and brushing off the people. And some of those guys and some of the girls have been coming back, and they're getting out of college, getting married now. And they come back and say, you know, I would have done this if I hadn't been exposed to you guys along the way, because it's not just mentoring. A lot of it is letting them come in and do their little growth spurt, finding an interest and moving along. And that has been like Najee and her mother. I think that's an excellent thing that's going on, because I realize at Najee's age, her mother has to do a lot of personal promoting and a lot of paying attention, because Najee, I'm sure, gets distracted. So
that's natural.
That's just the way it is.
You know, 11 years old, she's still 11 years old. I mean, we don't want
that's
to
what I'm saying. So
our age, right?
It takes a team.
It takes a village. It takes a village.
And then the other thing was Dr. Reed, when he was here, when he was saying something earlier, which is something I want to try and follow up on, is he was saying that the county health department has a transmission rate numbers, and I wanted to find out more about that. So Meg, if you could shoot me something on that, because
well, Dr. Moore, how is that ascertained? The transmission.
You can just go to your local public. You can type in I guess it would be the Department of Public Health. You just type in Department of Public Health. Your local Department of Public Health. Go to the website, and then you can. They usually have a search bar, and then in the search bar you can type in COVID transmission, or just type in COVID, and it'll probably pull up everything that you want to see. It'll have probably bullets of. You want to look at transmission rates. You want to look at vaccination rates in your area. You can look at a number of things.
Because I'm familiar with most of that, but he said something, and because I was only half listening, there was part of something that he said.
Yeah. So
Hold up. Don't be telling me you half listening to this show and it's gonna be on the show. Now you're gonna go back to your 30 seconds.
Let me just say, and this is a challenge, as we're having people learn virology and epidemiology and all these things all together at the same time, crash course. So it's the number of cases per 100,000 people. That's the rate.
You froze a little bit.
And then you freeze up. Right. Yeah.
Yes. As soon as he said that, I mean, he just stared it right there.
Follow Dr.
And the last thing before I go, is I want to say that I've always felt that I've done positive things for the community. I've always felt that. And but now, because of what we've been doing for the last few months that I've been with you guys, I've learned quite a bit. I've made some progress, and I've made contributions that I never thought that I would do, as far as health and community awareness. These type of things are very important to me, extremely important. And because you've introduced people that I've known from back a long time ago, like Jesse Jackson and some of his fellows in Chicago.
Right.
No,
Dr. Lafayette, you knew about him back then?
Yeah. Because he popped up. He said, "Oh yeah, you're from the West Side, from the Vice Lords."
That's right.
Yeah.
They don't be bringing that up. There is a statute of limitation, Andre.
Yeah, but what I'm saying is, I happen to be at that age where sometimes my wife and I sit back and she says, do you think we've done enough? And I say, well, what's enough? What's enough? We have 4 sons, all of them went through college. I don't even know if they're happy or not, but it doesn't make any difference to me. But they've all been through college, they all have degrees, and they're all doing various things along the way. And we're always getting communication from people that we've known from years ago, from churches, from the 100 Black Men. Boy, I did a lot of mentoring all across the board. That's what I'm saying is, I don't think that there's enough, but I'm one of those type of guys where if you say, hey, I remember you from 5 years ago, I remember you from 10 years ago, if it wasn't for you, then I kind of like that. I just want to say it.
Yeah.
Right.
You're making a difference.
Well, you are making a difference, man. And we are, and I joke at you a lot, Andre, but I absolutely love you. And I want you to know that.
Wait.
Hey, Andre, listen, let me say this. You kind of blessed us tonight with that example. Just spontaneously, that this has actually added value for you. Here's my question for you, my friend. You mentioned that you've been working with Emory over 10 years, and I love that the clinical partner's been around a while. But have you, since the pandemic and the relationship during the pandemic, is there a qualitative difference than what you were doing with them before? In your sense of them staying with this?
Why are you going to use the word qualitative? I mean, come on.
Is there a difference?
I mean, it doesn't mean, hold up. I'm not trying to suggest that Andre doesn't know the word, but you got a general public out here. And you talking about qualitative. What's that, a new dance?
Did you meet, was it new people from the same institution? Was it the institution's commitment? How would you describe that relationship now?
Well, it started off, I have to say this, it started off with my wife. They came by, they wanted to do, because of where our barbershop was located and we had a lot of people, they wanted to come in and do a little survey. And it grew from there because when I started talking to them, then I noticed that there were a lot of students that were doing undergrad work. And of course, they need help along the way. And I know that, because all my sons, they've had to do this work for free. But at least if I bring them to the barbershop, they can get some gas money, lunch, something like that. Right. And Dr. T, you and I have had this conversation before where there hasn't been a lot of money between Emory and us. Okay. However, there has been a lot of information exchanging things. And some of the people from Emory, some of the people that we work with, have gone on and they started and expanded these programs like Dr. Moore, not him in particular, but they've gone on and started programs as well as that, because, you know, when we're talking about Emory, we're talking about people doing these
Andre, I know that you're doing very well. Dr. T teed you up.
I know.
So but he knew the time was going on, and he's gonna make me the bad guy because he always does that. So Andre, thank you so much. Michelle, let's bring Michelle up a second. Michelle, how you doing?
I'm Michelle.
Good.
Hello.
Hey, Michelle, how you doing?
I'm doing great. How are you guys doing?
Good. Tell people where you are.
I'm in Cincinnati, Ohio. I'm the owner of the Hairport Barber and Beauty Studio. And I'm telling you, I've learned so much from being in this group, from being a wellness warrior. And I look forward to being here every Thursday night.
Yeah. Well, we absolutely adore you.
Well, right? Thank you.
And thank you so much for what you're doing.
Thank you.
This is family. This is beyond just, you know, Dr. Moore, we really are family, man. And we constantly just kind of boost each other.
That's right.
You know, and help
hope alive.
Keep each other up and keep hope alive.
Let's keep talking while they bring up the cloud.
Let's bring the cloud up so we can do that. We got 3 minutes, Dr. T. You see how I do this? You see how love is?
Look at this. Look at this.
Conquers all, right? Thankful.
Oh my goodness.
Ready, happy, rejuvenated.
Okay.
Absolutely. I love it. I mean, it's all wonderful for spaces. The larger the word, the more people said it. And so we
see a whole lot of rejuvenate out there.
It's a whole lot of people. No, a pun intended, Stacy. I'm sure. But it's all good. So that's wonderful. So thank you all so much for doing that. Well, the clock on the wall says it's 2 minutes before we leave.
Unbelievable.
Again, I am so happy. I see Najee is where is she? She went out for a second.
Is it her bedtime?
She wants to go study. She has an exam, a World War II exam tomorrow. So she wants
for her. That's
absolutely. So I want
thank you, mother.
Thank her for us.
Yes.
Right. And you didn't tell people your name and tell us, because I think you are an example of a great mother.
Absolutely,
right.
Mom.
So tell people who you are.
My name is Jamie Graham. I'm from Philadelphia, Pennsylvania. I'm the proud mother of Nijay.
Absolutely. Well, you are absolutely a role model for mothering, because we talked about other mothering.
That's right.
You are really a great role model for mothering.
Thank you. And thanks for being so welcoming.
Absolutely. We love you so much. Thank you so much for being a part of it. Count yourself a part of the family.
Absolutely.
Okay. All right. Dr. T, it's 1 minute left. And so I got to say goodbye. Dr. Ian Moore, man, love you, man, so much.
Buddy.
And thank you so very much. Dr. Reed Tucson, who came on and really laid out some things for us. Of course, Nijay Graham Henry's the world's youngest female barber.
Let's tell her we snap for her. Give her some
snap for her. We love her
and
so
wishing
much.
her the best on that exam.
Absolutely, we're doing that. Sandra Jenkins, we love you so much. We don't have to tell you because we tell you every time. Dr. Ritter, Dr. Carol Ritter, our resident physician. Andre, thank you, man, so much. Andre Russell of Atlanta. And of course, Michelle, thank you, sweetheart, from all the way from Cincinnati, Ohio. And of course, Stacy Ruffin from Philadelphia, from Rejuvenate. I
was just going to say, Michelle, say something for Najee, who's not here, that will be on the record.
Well, I came in a little late, but I did hear that she is a barber. And
11 years old.
11 years old. And to her mom. I'm also a barber, and I think that is so awesome.
Thank you.
And if she ever needs anything, she can always reach out to me.
All
Thank
right.
you.
All right.
Okay.
Thank you.
Yes.
Good. All right. Well, the clock on the wall says time for us to get up out here. I ain't gonna let nobody else say nothing. I take that back. Dr. T, you want to say something?
No, you send me out good all the time. And I think that as you can see, the way he and I go back and forth together, we are brothers of another mother. Omar, it's been a wonderful journey and we're just beginning.
Right.
And you see this, and this has all been mostly organic. Imagine if we actually had resources.
We got resources.
Save a lot more lives.
There's a whole lot of resources that we have. A lot of times it's invisible capital. And what
there
we
you
don't
go.
do,
We're using it.
Yeah, and we're using it. But anyway, thanks so much for everything. We'll catch you next week on this wonderful show called The Cutting Edge. And as always, I'd like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. Till next week on The Cutting Edge. Have a wonderful day. Bye-bye.
You got